Hello, Mr. Jones. I'm glad that we can make this video so you can refer back to it regarding your hypertension. Please ask any questions afterwards, and I will do my best to answer you. So first things first, hypertension is when the blood flowing through the arteries is just too much pressure. And when that happens, it can be three different types of hypertension. The first being called primary or essential hypertension. The cause is unknown, and however, diet, lifestyle, and age can play a role in that diagnosis. And contributions to essential hypertension can be smoking, too much alcohol consumption, stress, poor weight management, and too much salt in the diet, and a lack of exercise. And that primary hypertension diagnosis, your readings are between like 130/80 and above. And typically, to be diagnosed with primary hypertension, you have to have two instances of a raised blood pressure that your primary care doctor or whoever is managing your hypertension has record of. Secondary hypertension is the next tier, and that means that your hypertension has an identifiable and potentially reversible cause. So what that means is that it could be from the narrowing of the arteries that supply the kidneys, adrenal gland disease, side effects of medication, especially birth control, antidepressants, and diet aids, obstructive sleep apnea that's undiagnosed, hormonal imbalance, thyroid abnormalities, and constriction of the aorta. So most of the time with secondary hypertension, if you can get to the bottom of the reasoning, it can be corrected. And that secondary range is about 140/90 and above. Now, where it gets a little tricky is complicated hypertension. Complicated hypertension is an emergency. It can be. It's when your blood pressure is 180/120 or higher. This is very difficult to manage and requires multiple medications for management, and it can cause damage to the organs and the arteries. In a hypertensive crisis, you can have chest pain, headache, shortness of breath, dizziness, and visual changes. And if that were to happen, that's a medical emergency and can cause an aortic dissection, tears or bleeding to the arteries, as well as bleeding in the brain. So that is a very scary situation. Based off of what I know about you, you are a 40-year-old African-American male. That already makes you at higher risk for hypertension. You have a long-standing history of hypertension, as well as a family history of hypertension in both parents, as well as diabetes in your mother. All of these things are a higher risk factor for yourself and makes you more susceptible to uncontrolled hypertension. You're a police officer in a high crime area, so that's a high stress job that can also contribute to your hypertension. And you drink a moderate amount of alcohol. The best thing that I can think that you can do for yourself is to kind of try to change and do diet modifications and lifestyle changes. Doesn't have to be huge at first, but cutting down on the amounts of alcohol, switching to a low sodium diet, and just a small exercise regimen, even if it's just walking, would be great. The recent weight gain is probably also contributing to your hypertension. So all of these things, with just some modifications in your lifestyle choices and diet and alcohol consumption, would really do some good. What also I would like to talk about, since you do have these risk factors, so if we do not correct the hypertension now, we have a higher risk of you developing what's called left ventricular hypertrophy, or an enlargement of your heart muscle. Due to the constant straining in your heart just continuing to pump against high pressure, this can lead to arrhythmias, decreased cardiac output, and potentially heart failure. So all of these things, if we can get a handle on it now, it's not really something that we should be worried about. But really just lifestyle lifestyle changes, diet modifications, and just being more aware of your blood pressure and frequently monitoring it can make all the difference. Please let me know if you have any questions.